Malaria is a common fever which can also be fatal. It is generally believed that malaria is caused by mosquitoes. However, mosquitoes don't cause malaria, they only spread the disease. It is caused by a parasite called Plasmodium that lives in mosquitoes. There are four species of Plasmodium: Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, Plasmodium ovale. Plasmodium falciparum and Plasmodium vivax are most commonly seen in India. They are also responsible for the malarial fever that rises every alternate day.
In malaria, fever begins about 14 days after being bitten by a female Anopheles mosquito. The mosquito requires human blood for fertilizing her eggs. This 14-day period is called the incubation period. The patient starts shivering and feels very cold. The fingers and lips may turn blue and the skin may dry up. About 15 minutes to an hour later, the patient starts feeling very hot and the fever rises to a very high degree. At this juncture, the patient starts feeling very thirsty. He may also experience severe headache and vomiting. Then, about 2 to 6 hours later, the fever subsides with intense perspiration. The patient starts feeling sleepy and after waking up feels very weak. These are the common symptoms of malaria. Sometimes there may be some complications. The patient may have fits. He may start speaking incoherently and he may also become very aggressive. These are symptoms of cerebral malaria. Cerebral malaria is caused by Plasmodium falciparum. At times, along with fever, a patient may also complain of black urine. This is called black water fever and is also caused by Plasmodium falciparum. A patient may also complain of weakness, giddiness, swelling in the lungs, blood in urine, jaundice, etc. Malaria can cause anemia among pregnant women and can also lead to miscarriage of the fetus.
Malaria begins when an infected mosquito bites a human being. The malarial parasite gets injected into the human being along with mosquito saliva when the mosquito bites the human being. The parasite first enters the liver. After passing through various stages of development, the parasite enters the red blood corpuscles or RBC in the blood. Here, it multiplies very fast and the RBC bursts. This causes fever to rise in the individual. The entire process takes about 14 days. When the RBC bursts, some parasites enter new RBCs and the process begins again. This is when fever rises again. Some parasites remain in the liver and can become active at any time. That's why complete treatment is needed even after the fever has subsided, so that it does not rise again, or we can say to ensure there is no relapse. When the RBC bursts, some parasites get modified into male and female gametocytes. These male and female gametocytes enter the mosquito through the blood it sucks from the human being, and the mosquito now gets infected. In this way, the malarial parasite completes its life cycle in the bodies of two hosts, the mosquito and the human being. Any fever can be malaria. Therefore, it is very important to get one's blood tested on the advice of a doctor, a volunteer in the village, etc. A blood test helps in identifying the species of the parasite present in the system. When a blood slide is prepared, a patient with fever in a normal area is given 1 day's primary treatment, while another in a high risk area is given a 3 days primary treatment of chloroquine tablets. Once the disease is confirmed through a blood test, the complete treatment needs to be taken. Generally speaking, the complete treatment for falciparum malaria is of 1 day, while that for vivax malaria is of 5 days, even though the fever may have come down. If it is confirmed that the malaria has been caused by Plasmodium vivax, a radical treatment of 14 days is essential so that the fever does not return. In India, usually a 5-day course of primary treatment is prescribed under the National Anti-Malaria Program. Every individual residing in an area that might have malaria should undergo this treatment. Malaria eradication does not mean the elimination of mosquitoes, but the elimination of the malaria parasite from the human population so that no further occurrence of malaria is possible. In India, the malaria control program was first launched by the government in 1909. This underwent changes over the years and in 1958 came to be called the National Malaria Eradication Program under the Ministry of Health and Family Welfare. In 1977, the modified plan of action was evolved. 1995 saw the launch of the Malaria Action Program, while in 1999 the program was renamed as the National Anti-Malaria Eradication Program. Under the National Anti-Malaria Eradication Program, trained personnel visit door to door to identify probable patients. They conduct blood tests and give medicines. The blood tests and medicines are available free of cost with employees of the Anti-Malaria Department, government hospitals, primary health centers, medicine distribution centers, fever treatment centers, panchayats, post offices, village health workers, and teachers, and so on. Anti-malaria workers conduct blood tests and identify the kind of parasite as well. They also spray insecticides at places where mosquitoes reside, like inside houses, drains, stagnant water bodies, etc., so that the mosquitoes present there are destroyed and the malaria infection cycle is disrupted. The public can itself adopt some simple strategies for the control of malaria. Potholes, ditches, etc., where water can collect can be filled in to reduce the number of mosquito breeding sites. This can be achieved through de-weeding, desilting, filling, digging, and channelization. Special types of fish which eat malaria larvae, like guppy and gambusia, can be introduced into small ponds and tanks that cannot be filled up. Overhead tanks, water coolers, and ornamental fountains should be cleaned every week to prevent breeding of mosquitoes. Try to ensure that water does not collect in old tin cans, useless utensils, tires, etc. Mosquito larvae can be destroyed by spraying medicines like Tamifos and Phantian. Use mosquito nets while sleeping. Use wire nets on doors and windows and keep them closed in the evening to prevent the entry of mosquitoes. Use mosquito coils, plug-ins, mats, and ointments. Malaria can be totally eradicated from the root. It is a local disease and needs the participation of the local people for eradication. If the citizens are aware and act responsibly, malaria can be eradicated.